Welcome to the Nashua Public Library. My name is Susan Elberger. I'm a state representative from Ward 1, and this is the first of two forums that we are presenting concerning issues of concern to Nashua residents. Tonight's is about women's health and reproductive justice in New Hampshire, and family issues, education, certification, and the resources available to you. I'd like to introduce our first speaker, who is Paige Beauchemin. She is a state rep from Ward 4 here in Nashua. She is a registered nurse, a PMHC, and working with moms and babies for nearly 25 years as a massage therapist, educator, and nurse. She earned her degree in psychology with a focus on women's health from Chatham University in Pittsburgh, Pennsylvania. In 2009, she graduated from UPMC Shadyside School of Nursing. As a nurse, she has experience in a variety of maternity and psychiatric settings, from inpatient to outpatient, and from very high-risk pregnancies to working with midwifery patients. She has also worked in health tech, building digital coaching programs for the reproductive years, with a strong focus on mental health and birth equity. Paige recently launched a new business, Owl Hive Health, where she provides education and consulting around perinatal mental health. As state representative, Paige has worked on bills to improve maternal child health and is already working on new maternal health bills for the 2025-2026 legislative term. Paige exudes passion in her personal, professional, and legislative work because she truly believes that peace on earth begins with birth. Paige Beauchemin.
Thank you. And is this working? And I know you can hear me anyway, but hello, everybody. Thank you for having me here today. And even though Susan said I don't have to, I'm setting a timer because I could talk about this stuff for a week, probably. So I forgot that I gave Susan such a lengthy intro, so I won't take too long for this, but I am Paige Beauchemin. I'm a registered nurse. I started 25 years ago providing massage for fertility, pregnancy, and infant massage. And so then I've been doing work as a registered nurse for the last 15 years. And the work I do is primarily around women's and maternal child health, and I'll kind of explain what that means a little bit more in a minute. And I have really focused on mental health and health equity that entire time. And so I'm an educator, so I do lots of prevention and birth education. And really my goal is to help people to understand how we can support parents by starting in pregnancy and getting them the support and the health care and the education that they need so that we're setting them up for success. As you can see, I am also a New Hampshire state representative representing Ward 4, and I did just launch Owl Hive Health. And if you have other questions, I'm happy to tell you, but hopefully you feel confident getting this info from me today. So I'm going pretty high level, and I can always get you more details, and there's a lot of things that we can kind of, if there's interest, we can go down that road more. But basically, I want to make sure that everybody understands what women's health means, because we're tossing the term reproductive justice, women's health, all these things, and then really kind of understand some of the top issues that are impacting women's health in New Hampshire, and then talk a little bit about solutions or lack of solutions and what's coming down the road in different ways we're trying to impact solutions in New Hampshire. Okay, so what does women's health mean? It's an umbrella term. And this isn't official, but I kind of have broken it down here so that you can see when we're talking about different things. So maternal health includes the trying to get pregnant or infertility, the whole pregnancy, and postpartum. That's what we would really call maternal health. It all fits under reproductive health, but a lot of times when we're talking about reproductive health, especially lately, people think that means abortion, or they're just thinking about pregnancy care. And what we really, really need to do is it's very important for us to be aware that women's health care, basically by the time you get to the abortion or an unplanned pregnancy, you're way down at the end of the line. You're downstream. And so what we need to be doing is really, really, as we're advocating for our reproductive rights, also advocating for sexuality education, for access to contraception, things like that. So I want to make sure that people understand that reproductive health means puberty, sexual health, having access to clinics or your provider, other things like PCOS, endometriosis, menopause, and that kind of gets to the next point, which under women's health, there's also all the other systems of the body. And the reason that that is important is because most diseases out there present differently for women than they do for men. And so when we say we want women's health and reproductive justice, we're even meaning to the extent of understanding what a heart attack looks like, because we haven't done research on women. We've used men as the default, and so we don't understand how diseases present. We don't understand how medications work effectively. We also really are lacking in information in conditions that don't affect men, because not enough research has been put into them. So when we're looking at things like PCOS, which is polycystic ovarian syndrome, that is a condition, as is endometriosis, that impacts the uterus generally. And women sometimes wait 7 to 10 years from the first doctor's visit until getting their diagnosis. And basically the real cure that we have for endometriosis is a hysterectomy. So there's a lot of work to be done in women's health. And so if you do take something away today, it's to understand that while we're talking about abortion and reproductive rights, we can't forget these pieces of the conversation. We have to be talking about this, because otherwise we're really causing a divide, and we're getting at a subject that is divisive, whereas a lot of people can agree we want women's health. We want women to be healthy. The last thing I'll say here is, if it's not abundantly obvious, mental health is a part of every single piece of this, and it does present differently, especially during fertility, pregnancy, and most of these times, puberty, with a miscarriage or a loss, even after an abortion. So there are mental health pieces that are specific to women's health outcomes, and so I don't list that in every one because it's just a part of everything. So if you're not aware yet, and I do say this with all sincerity, this is the most dangerous industrialized country to have a baby. And that's across the country. If you look at this here, you can see the mortality rates in the US compared to these other high-income countries. And this is from 2018, that was pre-COVID. We're guessing that things are worse. We do know that some of the rates are worse, but every year they're getting worse. The really sad thing about this is that depending on what state or city or county you're in across the country, these outcomes are 2 to 4 times worse for Black moms and babies. What I'm saying is, for every 1 white woman that dies, 2 to 4 Black women or babies die. And it's been that way since I've become a nurse. For 15 years, I've been trying to address this. So that's something to think about. There's a lot of reasons, and that's another talk, but I can give you some of them. So some of the ways that we look at health around, so what I'll do today is, we don't have all the time in the world, so I can't go into everything. So I'm gonna focus on my particular specialty, which is maternity and maternal health care, because it is something we're focusing a lot on the state right now. When we're looking at measures of health for this time period, we look at a few different things. So we'll look at preconception health, things like Is somebody eating healthy? Did they stop drinking alcohol before they got pregnant? Were they taking prenatal vitamins? Those kinds of things. Are they, are they suffering from an addiction? The next thing we look at as a measurement of health when we're kind of looking at outcomes is when they had their first prenatal visit, because we want women to have that around the first trimester. And so if they're having it later, the later that a person has their first prenatal visit, the higher their risks are for poor outcomes, because we want them to get the good care from the beginning. Pregnancy health, obviously, they measure a lot of things: blood pressure, diabetes, weight gain, all of that. The delivery, obviously, delivery is kind of what people often think about when they think about maternal mortality. The reality is that actually most of the deaths happen the first year postpartum, after the delivery. So very few of the maternal mortality deaths are happening right in that delivery period. And like I said, up to 1 year, we also look at people's health, because that's when maternal mortality is met. That's the time frame in which it's measured. Another measurement of health, of the outcomes of pregnancies and deliveries, is breastfeeding initiation and duration. So we're looking at all of these factors that impact these outcomes. And I'll look at some of those factors in a minute. But these are the primary factors that we look at that kind of indicate how healthy are pregnancies. While we can look at maternal mortality rates, yes, we don't want those rates to be high, but we also want people to be healthy if they're living, right? Just because they didn't die from something doesn't mean that there isn't a lot of damage happening or other poor experiences and outcomes. So risk factors, some of the most significant risk factors: access to healthcare before, during, and after the perinatal period. So this affects that preconception health. If people are not able to get access to care for things like we said earlier, have they been able to treat their sexually transmitted infections, or did they not get treatment and now that's impacting their fertility or their pregnancy? Do they have access to dental care? Dental care actually makes a huge impact on a pregnant woman's health. So things like that. Obviously, during pregnancy, it's super important. And as far as I know, all pregnant women are covered under Medicaid during pregnancy. One of the big problems is, until very recently, that coverage, at least in New Hampshire, only, Heather, you might know, 8 weeks, 6 weeks, 60 days. So that was 60 days, which is ridiculous when we know that the majority of deaths happen up to that first year postpartum. So one good thing I will insert here, and I think Heather will reemphasize it, but one of the bills that we passed in the legislature last year was called the Momnibus bill, and they extended Medicaid coverage up to a full year postpartum. And that is going to make a significant difference in health outcomes. And we should, once that happens, we would expect to see those maternal mortality rates in New Hampshire drop. But other factors, if you haven't been in healthcare, you might not have heard of SDOH yet. It's a term that is everywhere in healthcare. It stands for social determinants of health. The most common ones people talk about are food, housing, and transportation. Obviously, you could tell all of those things will impact the health of a pregnancy. The other thing that's specific under SDOH during this time is partner and support systems. So having support from a healthy partner and a healthy relationship, and then other family, friends, community, that kind of thing. Being a member of a marginalized group or community has huge risks that go with it. I already talked about the Black community. The numbers are different for the Latina community as well as indigenous populations. They're all a little different, but they are all worse than the outcomes for Caucasian women. One of the problems we have with some of these other categories, such as sexual orientation and gender, disability, neurodivergence, especially with the sexual orientation and gender identity, we don't often capture that information in healthcare. So it's not in the intakes, it's not recorded anywhere, so it's hard to do research on outcomes for populations when you don't know who they are. And that's actually true for the Black and brown community as well. It's not standardized to ask for race or ethnicity. And so that's another barrier to actually getting the real data. But most people in this space are guessing that the outcomes are similar for other marginalized groups. But we definitely need more data and research in that area. Mental health is a really big risk factor, and I didn't say this earlier, but the #1 pregnancy-related cause of death is mental health. That includes overdose and suicide within the first year. But the majority of pregnancy-related deaths are associated with mental health. Interestingly, about 20% of pregnant people will suffer from a mental health condition. If you think about something like diabetes or preeclampsia, changing a little, but anywhere from 3 to 7 or 8% of women get those conditions. But what do we talk about and what do we screen for? So this is one of the most significant barriers to better health outcomes. The next piece, the intimate partner violence, goes hand in hand with that. Obviously, when we're talking about intimate partner violence and mental health, they're a self-perpetuating cycle, and that absolutely increases those risks for the substance abuse or the substance use and suicidal thoughts. And I can answer, that's my specialty, is perinatal mental health. So if we have more questions, I can get to that, back to that. The other thing that is really becoming a problem in New Hampshire and everywhere really is access to high quality evidence-based healthcare providers. So one of the reasons for that, and it's happening here in New Hampshire, is that labor and delivery units are closing, not only around New Hampshire, but around the entire country. And essentially the reason is they're not profitable. It's much more profitable to have a cardiac unit than it is to have a labor and delivery unit. NICUs just hemorrhage money. They don't make any money at all. And so these kinds of services are not profitable. And really nobody's you can't regulate. I mean, well, they haven't regulated really, keep this open. So hospitals are closing labor units down. Now, what's happening is, and if we think about the North Country of New Hampshire, there are some people who are now pregnant and are living 2 to 3 hours away from a hospital. And the rates of unplanned location deliveries, which basically means car deliveries or delivering somewhere you didn't intend, have been going up in the last few years. And I do have a report here that has the exact statistics, but I don't remember statistics, so I figure you can come get them if you're a numbers person. But they're going up so much that some of the work that we're doing in the legislature this year, we're looking at increasing EMS services to address the car deliveries. In short, that's a very abridged version of what's happening, but that gives you an idea. Partially because of those closures, it's difficult to have access to midwives and obstetricians. The other thing, though, is that midwifery care is one of the #1 things we can do to improve health outcomes. When you look at midwifery care, that maternal mortality rate goes way down, and in fact, the discrepancies for women of color nearly disappear with midwifery care. 90% of women would be good candidates for midwifery care. So only about 10% of pregnancies are high enough risk that they would have to see an obstetrician. Most of the other countries that we looked at, primarily the ones that are safer, primarily use midwifery care. And the collaborative model there is that a midwife tends to healthy, low-risk pregnancies. Then, if something comes up, they're referred to the obstetrician, who is a doctor of pathology, a surgeon, and they can manage those high-risk situations. So that's one thing we need to do. The problem being that there's a lot of barriers to entry for midwives, training, the cost of training, and most is the cost of their education versus what they make and what their salaries are. And so another big issue here are the reimbursement fees from insurance companies. So basically what we're looking at is we need, with the low reimbursement and the very high liability insurance that these type of providers need, it's basically killing that industry. And so we've got to figure out something in the middle so that we can continue to, they have to be able to afford to practice. And right now we're making it's not possible. So we've got to figure that out. Substance use and perinatal mental health during pregnancy, we kind of talked about that a little bit earlier, but what that means is we have almost, we do not have consistent high quality screening for mental health and substance use. And so some of the efforts that we need to start implementing better processes for screening for mental health and substance use in the first trimester. Lots of people talk about it as postpartum depression, but again, most of the mental health conditions start during pregnancy. So we need to be looking for these signs, in addition to signs of intimate partner violence, before delivery, so we can start getting people those services. But we're not gonna catch everybody, and lots of people still need other support, so we also need to increase our postpartum support. That's another place where we can really, really make a difference in people's health. Because again, most of those deaths occur that first year. So some of these things we can do, I kind of talked about both of them. So more midwifery care, better fee reimbursement, the perinatal mental health screening, referrals, and treatment, more robust postpartum care, including doulas, lactation support, and home visitors. That was in the omnibus bill last year as well, and so they laid the infrastructure for Medicaid reimbursement for birth doulas and lactation support. So that's coming down the road soon, that women will be able to get these services in their homes, and those providers will be reimbursed. The other thing that we need to improve health outcomes is paid parental leave. The other difference between us and other countries is we have we barely have any leave anyway, and then it's not paid. And that's one of the major risk factors that would really change things. So I am getting close to my end here, which is great because this is my last slide. So we do have we have a lot of advocates here in the state that are working together. So we have the New Hampshire Department of Health and Human Services. They collect the data, they put out reports for us. The New Hampshire Women's Foundation also, they have put some of these reports together, and they are the primary advocates working with some of the legislators to write some of these bills. Nepequin and NHPQC are fairly new. Nepequin is Vermont, New Hampshire, and Maine, and then NHPQC is just in New Hampshire. So they just started within the last year. They're attached to Dartmouth-Hitchcock, and what they're doing is they are building 13 coalitions across the state of New Hampshire, and each of those coalitions will include everybody they can find in that area who is at all involved with maternal health care. So every single hospital in the state that has labor and delivery, really anybody you can think of in an area. And so ours in Nashua, we will have that together by March. So this year they've got like 5 or 6 of the coalitions together, and then they'll work on the rest of them. And then we can finally get people together and say, this is everything that's being done in New Hampshire. This is what we want to address. Let's work strategically so that we can chip away at all of the pieces we need. As I said, we are already working on Momnibus 2, and before I even got there, it wasn't my influence, but I'm glad I'm there. The first thing that had already been decided to work on was screening for perinatal mental health. So we're working on reimbursement's an issue there. Everything they do in the doctor's office is another task if there's not reimbursement. So we're working on getting reimbursement for those screeners as well as looking at supports for the North Country, for opening more hospitals, gaining access to midwives, and then really doing as much as we can to bump up that postpartum home visitor work. And that is it for me. Thank you. Yeah, does anybody have questions? Go ahead. I know you get, it's your floor. This is a one-on-one.
I think this is more of a clarification.
Yeah.
I know pretty much all of your presentations about mental health.
Yes.
And these issues, but the mortality rates.
Yes.
You showed.
Yes.
I assume that's, is that cover the delivery time when the mother and her infant dies?
Yes.
Not just the mental health reasons.
No, so.
I'm sorry, repeat the question.
Oh, okay, so let me clarify. When you're asking about the maternal mortality rates, you're asking about, wait, can you say it again? I did get confused.
Does that include, I mean.
Does this include mental health?
Includes like mental health and the delivery.
Yes,
When
yes.
I think about women, mortality rates, I think of in the delivery process, or the baby's born, the mother dies. That's
Right.
not just, but you're saying this includes, say, up to a year postpartum.
That's correct. So the question is, this graph here, does that include just the delivery or the delivery and up to a year postpartum? And the answer is it includes the delivery and up to the year postpartum. And that is because so many of the conditions that maybe start at delivery, they're not severe enough or they build over time. And
Must not get addressed. If in that first year you're dealing with a newborn baby,
well,
right? And maybe that doesn't get addressed with the woman, the mother doesn't,
yeah.
follow up on what's happening mentally or physically.
So yes, and so many of the conditions do start during the delivery. People can have a hemorrhage up to a week later. You could become preeclamptic and have a seizure for a certain number of weeks. You could have heart issues that start and then don't get worse till later. But yes, the physical conditions that lead to death are usually focused on the delivery. There are physical conditions that happen later, but most of those that happen in the first year are going to be mental health related. Mm-hmm. Yes?
I have a couple of questions.
Sure.
One, I noticed by its absence, IVF, in vitro fertilization.
Sure.
And I'm wondering how much of an issue that is in New Hampshire and what kinds of things is being done about it.
Sure. So the question is IVF wasn't mentioned, and so what does that look like? And I'll tell you, I did put fertility. I'm one of those positive language people, and I don't like to use infertility because fertility includes if it's happening or not, technically, and it does impact mental health, but the infertility isn't. The negative health outcome of infertility would be not getting pregnant, so it's not necessary. It's kind of in the maternal health space, but there's not a lot of negative outcomes that we're looking at when we're looking at health outcomes. Obviously, it's terrible what people go through, and not being able to get pregnant is its own situation. But technically, when you're looking at the health outcomes, the IVF piece isn't necessarily a part of what we're looking at in the maternal health piece. Like once you get pregnant, I do think I have information on IVF. I don't know the numbers, but I'm happy to look at that with you afterwards. It's a great question, and it's very important.
My second question, you've spoken a lot about New Hampshire or New Hampshire and surrounding area specific activities. Are you seeing more activity coming from the national government or less activity than you would like to be seeing?
It depends on what the issue is. I know that recently we've been seeing a lot more federal money put into women's health research, which is why I did want to clarify that, because a lot of the federal money we're seeing, that I've seen, is more about overall women's health research. So that would mean the other body systems I talked about, so like cardiac or other things like that, and how they present in addition to PCOS and endometriosis, in addition to the maternal health outcomes. I think really where you see the best outcomes are state-based. It really depends on the kinds of laws that are coming out of the state. The federal government is not above and beyond right now. Any other questions? What?
One of the things that you mentioned early in your presentation was what Webb just mentioned about lack of research into how women's health is not anywhere near as well known because the research has been done on men.
Yes.
I was at a presentation or an event where some students had been doing research about pain and how women's pain is not taken as seriously as men's pain, that it takes longer for doctors and other medical providers to recognize that, oh yeah, that's really pain, it's not a woman complaining. Could you
Yes.
speak to that a bit?
I could speak to that for a long time. But yes, and this is why we also see that women of color have worse outcomes because of something we call intersectionality, where we know that women are not listened to as much as men, people of color are ignored more than white people are, and so when you start adding up those intersectionalities, it gets worse and worse. In fact, there are people who are still doctors who, when they went to med school, they were taught that people with black skin have a higher pain tolerance. And so the same is true for people of color. It takes much more for them to get the medication they need to control pain. There's definitely research that shows that when you have a provider that looks like you, that you have better health outcomes. And that's true for women and for women of color. Would you like me to add anything else? Because I'll go on.
I'd like to
Sure.
extend that question. Is the reverse true? Are doctors of color treating white people any more insensitive to the reactions of white people?
I don't know of any specific research. My understanding of the space overall is that it's more about that implicit bias. So we can have what's also called internalized bias, right? Because of the culture that we live in, we see images of a certain race in a certain way. Even people of that race can internalize those messages and still treat people of their own race similarly. So my guess would be that that's more a product of being a part of the dominant culture as opposed to your race. It's more about it being the dominant race having power over the oppressed as opposed to the actual color of the skin. That's a great question, thank you. Does anybody else have any questions? Okay, well, I think I will bring Heather up. Oh, I think I'll bring Susan up. Yeah.
We're good? Thank you, Paige. That was a lot of information and a lot of wonderful information. Even for some of us who think we may know a fair amount, it's shocking to learn how little we know. We have Heather Raymond coming up right now to be talking. She'll be talking about family issues, education, certification, and the resources available to you. I'd like to tell you a little bit about Heather. Heather is running for re-election to the New Hampshire State House and is halfway through her second four-year term on the Nashua Board of Education. She first decided to run for office in 2017 to further her commitment to helping create a better future for Granite State children and families. Before getting involved in politics, Heather was a child and family social worker and a volunteer with a number of community nonprofit agencies who provide food, services, and support to children and families. On the school board, Heather served as president for 3 years, chair of policy for 3 years, and clerk for 1 year. She negotiated competitive pay increases for faculty and staff while keeping costs within budget. The board invested in complete renovations to 5 schools, built a state-of-the-art middle school, added security vestibules to 8 elementary schools, installed solar panels to 6 schools, and ensured that all projects prioritize energy efficiency in addition to modern educational amenities. Heather's work on the Board of Ed invested in our students by expanding CTE programs, adding English language learner supports, expanding special education services, and creating a one-to-one Chromebook program to ensure that all Nashua students have up-to-date curriculum and technology to help them to succeed. At the State House, Heather serves on the Children and Family Law Committee and the DCYF Advisory Board, that's the Division of Children, Youth, and Families Advisory Board. She co-sponsored bipartisan legislation to protect student data that passed both houses unanimously. Not an easy feat in the New Hampshire State House. She also authored a legislative amendment that created guidelines for reunification techniques to ensure that parents and children receive safe and effective interventions from skilled practitioners so they have the best chance to repair and build relationships free of abuse. Both bills were signed into law this summer. Heather Raymond.
Thank you. I really enjoyed Paige's talk because I think we overlap really, really well. And a lot of the stuff that she was talking about maternal outcomes and the factors that go into healthy moms are what also make healthy families. And so before I started getting involved with politics, I was a child social worker for a long time. I started my career as a forensic interviewer. So I worked with law enforcement agencies in New York State, interviewing children who were victims of violent crimes and sexual abuse. And I did that for many years until I had my own kids. And then I became a DCYF worker when we moved to New Hampshire, and did that for a few years. And then I worked for CASA as a program manager for about a year. And then I decided to be a stay-at-home mom. So I have done a lot with families and also experienced whether or not my advice was good once I was at home with mine. So that's been fun. So I just pressed the arrow, right? All right. So I'm going to talk about families and childhood. There's a little bit about education in there. There's a little bit about DCYF. It's kind of an overarching, picking up really right where Paige left off when kids are born. It really is. It's like we put it together, but we didn't. All right, so Paige talked about the Momnibus bill a little bit. It's SB 175. It was passed by the House and Senate in 2023. It expanded Medicaid eligibility for women and babies from 60 days to 12 months. And I cannot emphasize how important this has been. Over 3,800 moms and babies were able to access increased services. And some of the services are, like Paige said, doulas, lactation services, donor milk, services through our family resource centers, which is something new in New Hampshire that came about in the last 5 years. And these are basically hubs around the state that provide family support, from parenting classes to referrals to social work and to mental health treatment. Pretty much anything that you need if you're having some struggles as a family. And I'm really excited to see this. When my son was born, I had everything that Paige listed as a complication with pregnancy. We had a really hard pregnancy. And then we used the NICU, and we were very expensive to New York. But New York had a visiting nurse program. So for the first 3 months of my son's life, I had a nurse come into the home and work with us 2 or 3 times a week, which at first I was like, oh, I'm a social worker, I know all this. But having that extra support as a first-time mom without relatives nearby was humongously helpful. And that nurse was the person who noticed that my son had torticollis, which required 9 months of physical therapy for him as a baby. So I would just love to see some of this programming come to New Hampshire, especially for our families who are a little bit more rural and don't have the ability to just drive 5 minutes down the road or take a city bus to get the services that they need. So I'm just going to leave it at that. So as Paige said, we're looking at expanding the Momnibus. I really completely support it. There was also a federal Momnibus bill that passed this year, and I'm on the Board of Education. One of the things we did with that is update our policy on breastfeeding to make sure that we have accessible areas for our staff who might be breastfeeding, because we want to encourage moms to have the supports that they need. So childcare. Most people in New Hampshire are working and being parents. This is what happens when you have kids. Most people need both of you to work in order to afford it. So one of the issues that we have here in New Hampshire is that childcare is astronomical. If you have 2 kids, the average price for childcare is $28,000 a year. That's like college, right? I remember when we moved here and I worked for DCYF, my entire salary, the whole thing, every penny I took home went to daycare for my kids, and they were an infant and a toddler at the time. It was worth it to me because I was working for the state and they had great health insurance. So it was a trade-off for my family that I was basically working so that we could have good health insurance. But one of the issues that we have here in New Hampshire is that we have a workforce shortage crisis, which Paige mentioned when it comes to maternal care and pregnancy care. You're going to find that this is a theme throughout the night, that we simply have a workforce shortage across the board when it comes to what families need. So one of the things that we did at the State House this year was Senate Bill 404, and this bill opens up the child care scholarship program to people who are working in child care centers, because we found that child care centers are full. Like, we don't have enough people doing it, but then there's also not enough spots for the number of people who want them. So it added some funding for that. We also passed HB 1212, which provides extra funding for child care centers from the state for children who have behavioral or developmental needs. Because previously, a lot of these kids were getting kicked out of their child care center because they're expensive, they need extra services, and the services just weren't available. And so now this allows child care centers to really hire people who are experts in that and start that work early. Because of these bills, the child care scholarship usage increased 21% in the first 6 months of 2024, which is absolutely huge. And I have a handout. I have a bunch of handouts if people are interested on that. So we're gonna, interesting. I'm gonna skip ahead here a little bit. I'm gonna go back to that one. Also with young kids, I wanna talk about lead testing. People who are my age remember lead testing. We remember getting the finger pricks, and then sometime in the last 20 years, people have forgotten that this is important. They've forgotten why there were all these big social programs for lead testing. And we found that the number of kids who are getting tested started dropping before the pandemic, and then it plummeted during the pandemic, and it hasn't returned to pre-pandemic levels. Despite this, over 800 kids in New Hampshire a year test positive for lead. Our buildings are old. There's a lot of lead paint. And people don't seem to remember what lead poisoning does. It has long-term cognitive effects on kids. And so we had a couple of bills this year about lead testing, and one of them failed. A big group of people came to oppose it because it wanted to mandate lead testing before kids went to school. And people didn't want the state telling them what to do. So that one failed. But the one that did pass, and it's effective this month, requires insurance companies to cover lead testing for ages 1 and 2. Still a little young, because kids, as we know, developmentally are still putting things in their mouth at 3 and 4 sometimes. But now all of the lead testing and the follow-up care is required to be covered by insurances, which will make a big, big difference. New Hampshire has a Healthy Homes and lead poisoning prevention program. and I put the number up there if people are interested. Pre-K and kindergarten. One of the things that I was surprised to learn when we had kids that age is that not only does New Hampshire not do pre-K, there's no funding for pre-K. At the time when my kids were little, they only had half-day kindergarten, and it wasn't everywhere. It's still not required to have half-day, to have kindergarten entirely, but the state did pass a law in 2018 to say all districts have to have half-day. Nashua adopted full-day kindergarten back in, I want to say 2017, but we pay for that out of your tax dollars. So thank you very much, Nashua. The state gives us very little money for kindergarten and none for those extra hours. So the other thing to talk about with kindergarten is back in 2018, New Hampshire passed a law requiring play-based learning in kindergarten. And people are very surprised to learn about this. It's really cool. The idea is that kids should be having fun, they should be engaged, and that you should get the lessons across through the play activity. So it's guided play, but you're pretending that you're running a store, right? And so you're teaching kids numbers by, if you want the pretend apple, you have to give me the pretend dollar. And, those are the types of skills that they're learning in kindergarten, which I just think is fantastic. And I have a handout on play-based kindergarten too, if anybody's interested. I'm going to skip back. I apologize, my slides were in the wrong order. And talk a little bit about youth mental health, because we tend to think of youth mental health for adolescents, but it really starts much younger. And so per the New Hampshire Department of Health and Human Services, 30% of New Hampshire youth have one or more emotional, behavioral, or developmental condition. But of those, almost half were not able to access care last year. And that includes early supports and services because of barriers to physically accessing them and barriers to just not having providers available. So again, we have a workforce shortage. We also have a shortage of beds for inpatient services for kids. I looked up for my PowerPoint today, and today there are 106 beds available. Usually there's about 30 more than that, but Hampstead Hospital is having a renovation. So there's 106 inpatient beds available, and right now there are 2 children sitting in emergency rooms waiting for beds to open up. The average wait time is about 3 weeks. Now, I cannot imagine having a child having a mental health crisis who has to wait in an emergency room. I've had to wait in an emergency room with my child for a broken bone or some other issue, and it is loud, and it is distracting, and it is not conducive to getting better. So this is something that New Hampshire really has to work on. We did do some things at the legislature. SB 444 and 22 was the ACEs Treatment and Prevention Act. ACEs means Adverse Childhood Experiences. And there's a test that anybody can go online and type in ACEs test and you can take it. It's a questionnaire and you get a score out of 10 based on what kind of experiences you had in childhood. Do you have a parent who went to prison? Was there substance abuse or mental health issues in your family? Was there physical abuse or sexual abuse in your family? The higher your score, the more likely it is that you have had ongoing trauma because of this. So there was a study committee, and the study committee found that one of the issues we have with the number of providers available is that our Medicaid rates are very low here in New Hampshire. They recommended at least a 20% increase, but really they were saying 25 to 30% increase in rates. The legislature increased rates by 3.1%. So that was maybe helpful, but we haven't seen a decline in the number of kids waiting for treatment. In 2024, we had passed SB 411, which is another study committee to look at mental health care and look at how many kids are waiting in waiting rooms, which is great, but we already know that they're there, so I would like to see some movement. And this isn't just affecting kids. Today there are 36 adults waiting in ERs across the state because they can't find psychiatric care for adults either. The other thing that we did, which was very good, were HB 594 and HB 1190, where we updated the licensing processes for social workers. The licensing board was kind of a Herculean task to go through all of the steps to get your license here in New Hampshire. So we've streamlined the process, and we've also created some reciprocity with other states. So if someone is licensed social worker in Massachusetts and they would also like to practice here in New Hampshire, we have an agreement. And we have this with several states across the country, which is helpful for recruiting people to come and move here. The number one thing people say when they get here is that it is a 6-month to 12-month wait to get their license. And in the meantime, they're not working and we have people who need treatment. So, segueing to school-age kids. So New Hampshire has a compulsory education law. It's in our state constitution. Article 3 says that all children in New Hampshire have a constitutional right to an education, a free and appropriate public education. And we have a law that says that parents are responsible for making sure their kid gets that education. So there's a few ways you can do it. In New Hampshire, there are 456 public schools and 162 school districts, and this includes public charter schools. And New Hampshire is ranked still 4th in the country for public schools. We have excellent schools here. We are ranked 50th for education funding. And I have a handout at the table about how the New Hampshire school funding works and doesn't work. And I think Susan will be talking about that next week, so I didn't really go into it a lot. One thing to note, and the reason that that school funding is becoming more of an issue for people, is that our population is decreasing for children. The public school enrollment has decreased 20%, private school enrollment has decreased 25%, and homeschooling enrollment has decreased 40%. And people are like, well, what about vouchers? Vouchers have not impacted the enrollment in schools really at all. Here in Nashua, we have about 9,500 public school kids. 40 of them have left the public school district to take vouchers out of the 9,500. So vouchers aren't driving kids out of the public schools, but what they are doing is they're driving our costs up, because most of the kids getting vouchers were never attending public schools in the first place, so it's almost all new spending. And I'll let Susan go into that next week about how that is impacting our property taxes. And just to note that 82% of all of New Hampshire's kids attend their local public school. And we're just not having babies. And I think anybody walking through their own neighborhood in Nashua can see this. I know in my neighborhood we've had 3 houses go on the market in the last year, and all of them had retirees move out and retirees move in. And these are, it's not a fancy neighborhood. We have Cape Cods and we have ranches and we have colonials. It's a nice mixed 1970s subdivision. But you would think if there's 3 or 4 bedrooms that we might get a family, and every time my kids are disappointed, there are no more kids coming in. And we do have the lowest birth rate in the nation, which is crazy. So just touching on funding, New Hampshire gets 70% of our funding for our schooling from property taxes. 20% comes from the swept tax, which is the statewide education tax, and 10% comes from the federal government. On average, and I rounded these numbers, it's like $4,100 and a few dollars. The state gives each school district $4,100 for each public school student, $9,000 for each charter school student, and every child receiving a voucher this year is getting $5,200. And so last year, our budget for vouchers was, I think, $25 million, and this year it is about $50 million. And they're expecting it to continue to rise as we continue to raise the income eligibility for vouchers. what they're finding is people who are already sending their kids to private school are the ones who are taking the vouchers and homeschooling. And just a note on that, the #1 recipient of voucher funds for New Hampshire, according to NPR, is Amazon, because people are using their voucher money to buy school materials for homeschooling. I was shocked. I was just absolutely shocked. And I think 85% of kids who are taking vouchers have never attended public school at all in their lives. And right now the law is once you qualify for a voucher, you're always qualified for a voucher. So it's 350% of the federal poverty level, which is about the same as for free school lunch. But once you meet that, you're never tested again. And in New Hampshire, the voucher program is not being audited. There's a whole rigmarole about that. But they did do a random sampling, and 24% of their random sample of people receiving vouchers were not eligible because they didn't live in New Hampshire or they didn't meet the income threshold. So I have some serious concerns, and I think we all should, because this is new spending that is impacting our property taxes. So let's talk about who's doing the teaching in New Hampshire. It turns out we're losing teachers at an alarming rate. We have a critical shortage of staff. I can speak to Nashua. We have 66 open positions for paraeducators right now in our district, and we have about half a dozen openings for teachers. And so we're doing the best we can. We have teachers who are taking on an extra class instead of a planning period. We have long-term subs who are coming in. So there's a lot of work that's being done at the state level to try and figure out what's going on with this. So in 2022, there was a committee to study the teacher shortage. And really what the committee found was that it's salaries. Teachers just aren't paid a lot. And if you go to the fair funding, the Education Fair Funding Project, they have a lot of graphs about teacher pay. And in some areas of the state, a teacher with a master's degree is starting at $35,000 a year, which is not enough. It's just not enough to pay your rent. Here in Nashua, our base pay for teachers is about $45,000 a year with a bachelor's degree. That qualifies for the new low-income housing that opened downtown. And so this year is teacher contract year. I'm everywhere being like, we just need to pay people more. But how do we pay people more when that directly impacts our property taxes, when the number of students is going down, so the amount of money we're getting from the state and federal government is going down? So there's a lot of push and pull, and so I expect over the next year to be having a lot more robust conversations about budgeting processes. So some of the things that New Hampshire has done, the Department of Education has created these alternate pathways for certification. Usually you major in education, and then you take a test called the Praxis. You pass the test, and then you can become a certified teacher. If you don't major in education, if you are coming from another area, if you were a business person and now you want to teach, or like me, I majored in psychology, but maybe I could teach English. There are ways at the state to get the certification, and you really have to talk to the Department of Education because it's unique depending on what you want to teach. But they are doing a lot of really creative things to get people certified. Unfortunately, this year they more than doubled the cost of the teacher certification from $200 to $500. One of the other things that the state is doing right now is that the State Department of Education and the Board of Education is reviewing the Ed 306s. And those are the rules that govern minimum standards for public education. This is it's not just public schools, but also charter schools, although charter schools have their own section of the Ed 306s. So right now, the proposals are things like increasing the maximum class size. So if we don't have enough teachers, we'll put more kids in a classroom. To eliminate certification requirements, both for public and public charter school teachers. I don't think having eliminating certifications instead of helping people to get the skills that they need is the way that we should go. And some of the other things that are being proposed at the state are eliminating courses and eliminating some of our graduation requirements. So they want to eliminate art, music, social studies was up on the chopping block at one point. But we do have civics as a graduation requirement. Like you have to pass the citizenship test or you can't graduate in New Hampshire. That bill passed a couple years ago, goes into effect for this graduating class. So there's a lot of moving and shaking going on at the state level when it comes to education. I'm going to be very transparent. I was one of the people who went up to the State House and said these changes in the 306s are not child-friendly. These are not focused on what kids need. I'm really proud of Nashua, and I brought a ton of statistics about Nashua, but what I would like our residents to know is that Nashua has the biggest career and technical education program in the entire state. We have the most AP courses. We tie with Wyndham in the state. So Nashua is not perfect, and there are things that we need to work on, but we've also done a really good job at investing in programming that serves our kids. I didn't put it in the slide, but I brought some data. There's data about funding, and then I brought some data about test scores and graduation rates. So it's interesting, New Hampshire is number 4 if you look at the country as a whole. But if you look at our state standards, our state assessment, most of our kids are testing at 50% proficient. So there's a major disconnect between where our standards are and where the rest of the state is, and whether or not our standards are measuring what our kids really need to know, or whether our kids aren't doing well on the tests, we're not really sure. But Nashua is at or just below the average for the state on most of the state testing. When it comes to graduation rates, we are at or exceed the graduation rates for the state. Let's see, I brought enrollment. I brought tons of stuff, so if people have questions, I probably have the answer in here. So child abuse and neglect, this is actually my wheelhouse. I've been on the Board of Education for many years, but I got there through this. So New Hampshire is about 30 years behind all of our neighbors when it comes to child abuse and neglect. Our laws, it's 169C, prohibits parents from physically injuring their children, neglecting the children's basic needs, sexually abusing them, or causing psychological injury. But the burden of proof is that you need a preponderance of the evidence that the child has suffered protracted harm or serious impairment. And that burden is really high. It doesn't say that in the law particularly, but that's been the case law for as long as I've lived here. And frankly, it burns out DCYF workers like crazy. So we also provide services for kids who are in the juvenile justice department under DCYF. Some really sobering statistics from the Office of the Child Advocate. So a few years ago, there were a number of high-profile child deaths in New Hampshire. Before Harmony Montgomery, there were a number of them. And so New Hampshire created a position called the Office of the Child Advocate, and her job is to look at all of the statistics, is to visit kids in care, and really get a pulse on what's going on in New Hampshire and provide guidance to the legislature so that we can make laws that support kids. I don't think it's going as well as it could, but we're hoping to address that at Child and Family Law. So the last annual report that's online for the Office of the Child Advocate found that 29 children under the age of 17 died in New Hampshire in the year of 2022. 18 of those were infants under the age of 1. I know from testimony in my committee, Child and Family Law, this past June, they just decided to pull medical information from the hospitals. And this past June, there were 7 babies under the age of 6 months who had broken legs or arms. Babies under the age of 6 months typically aren't crawling. There's just not a way developmentally for babies to break their legs. There's possibly they were rolling off a table and you grabbed them. Of those cases, only half were reported to DCYF, and most of them didn't get any services. So there's a disconnect somewhere. There's a disconnect with training providers, a disconnect with training DCYF workers, and a disconnect with our laws. And so there are a lot of agencies working on this, and I'm hopeful that we can keep going in the right direction. But I don't know. Last year, the legislature saw several bills that would have effectively hobbled DCYF and made it so they can't do the little bit that they're able to do now. So to me, it's really, really concerning. The other thing to know is even with that, 1,200 kids are currently in placement who have been removed from their home due to juvenile delinquency or child abuse and neglect. And most of them are in foster homes, but there are several hundred that are in residential care. One of the things that we did this year was we passed a bill that said that we need our kids to be in residential care here in New Hampshire, or as close as possible if we can't meet their needs here. There was a horrific case where a kid was in Tennessee and was being abused at the facility. And so that is not happening anymore. So that's a step in the right direction. Piggybacking on that, parents' rights. Parents' rights has been a hot button issue for the last several years. I do have a handout that lists parents' rights. The New Hampshire Department of Education put a technical advisory out a couple years ago that anyone can go on their website, and it lists current parent rights. And the truth is that New Hampshire is a very parent right focused state. We don't have a child bill of rights, but we do have a parent bill of rights, and parents have the right to decide where their kid goes to school, to opt out of anything that they don't like, to review any curriculum that they want to see, to know if their child is the subject of an investigation, to know if their child has experienced restraint or seclusion. We did pass a law this year, which I didn't note, that increases the transparency that schools have to provide parents when kids have a behavioral issue at school and they need to be removed from the classroom to, calm down. There's now this huge form. In Nashua, we're asking the superintendent to review every single one of those and then send a second report to parents. Because we're taking this very seriously. We want to make sure kids are safe when they're in school and that they're getting the services that they need. And I just put up there a bunch of resources for people who want to learn more. The New Hampshire Fiscal Policy Institute is a nonprofit. They're not even a watchdog. They're just an informational or research agency. Nonpartisan, nonprofit. That's where some of my financial stuff came from. The Fair Funding Project are the people who are suing the state over school funding. Nashua is part of that lawsuit because we think we should get more money and that would help our taxes go down. New Futures, Reaching Higher New Hampshire, are advocacy agencies, and they have a lot of really great information about child mental health and education in New Hampshire. And then all of the data that I have, I got from the Department of Education, Health and Human Services, or the Office of the Child Advocate. And all of that is accessible on their websites for everybody. So I could go on forever. This is
I know the feeling.
this is what I do. So I'm going to grab my drink real quick, though. Okay, sorry.
About school vouchers?
Well,
Oh, yeah. School vouchers, I guess I don't really understand what they are. Did you say
yep.
that school vouchers, so parents that are homeschooling or sending their kids to private school, they request a voucher and they get, what'd you say, $5,200 per
This year, yep,
child?
per child.
Per year. They just get paid.
Yes.
Wow.
And then there's no tracking.
So they might go on vacation with that money?
Well, one would hope that they wouldn't. I mean, there is some information. The Children's Scholarship Fund, who runs the program, have information, but they're not sharing it with the state right now.
Oh.
So,
Okay, so there's no real tracking of like, did they spend all the money on the education? Okay.
yeah, so there's
Of
some
your child.
there's some information out there.
Yeah, but not-
NPR did a study about where the money is going, but for the most part, no. And that's pretty consistent with every state that has vouchers. Like if you look at Ohio, Ohio has universal school vouchers, and they give more money depending on what your kid's needs are. So if your child has an IEP, you can get more money ostensibly to buy those services, right? Because now in New Hampshire, if your child has an IEP, the local school district pays for those services no matter where your child goes. So if you get a voucher and your kid goes to a private school, it is the local school district that is providing the physical therapy, the speech therapy, and we're paying for that. But in Ohio, parents get the money, and they're finding that two things are happening. One, private schools are raising their tuition costs to make sure that they're, getting the kids that they want. And two, parents are taking money and then just banking it and not necessarily purchasing the services. And there's no provision in Ohio law that would allow them to get that money back. Time magazine did a study, a report based on a bunch of studies last year. And the Time magazine article said that 20% of kids who go from public to private come back to public after a year, and that there's no difference in academic achievement between kids in the states that have private schools take their state assessments. There's been no evidence that kids do better. In fact, they do slightly worse. So I'm not a voucher fan. I think it can work in certain circumstances, but for the most part, it seems to be a way to divert money to private schools.
And just as a by the by, there's actually research out that shows that kids who are going to private schools do not do as well as kids who go to public schools. There's not a lot of it, but it's there.
So in New Hampshire, we don't require private school students to take the statewide assessments. And public school students can opt out too. About 20% of our kids opt out. There's a lot of ways that hurts us, but that's the law that you can opt out. We also don't require any type of assessment for homeschoolers. There's a form, I brought it, that parents sign when they decide to homeschool. And that's it, there's no follow-up. You fill out the form, and then when you're done homeschooling, you fill out the form certifying that your child is done and has completed secondary education. So that was a big change for me when I moved here, because in other states you have to submit something. So.
Thank you very much, Heather, for what you're explaining to us. I have a question or thought about the parental rights. If I object as a parent to something that's being taught in my child's classroom, please clarify this for me. So if I believe the Holocaust didn't happen or the earth is flat, I can pull my child out of that instruction from your classroom. What does the school do with my child then?
So the law says that the parent has the right to opt out of any instruction that they find objectionable. And the word in the law is objectionable. So in that example, the law says that then the school and the parent have to come up with an alternative lesson plan. That lesson plan still has to meet, like at the secondary level, we have minimum competencies, right? So that lesson plan has to meet our competencies, or the child could fail a grade. But it happens occasionally where a parent will object to a book, for example, like, the class is reading something and the parent doesn't want them to. Came up recently with Ender's Game, which is a science fiction novel about a kid who it's like an intergalactic war, and the kid thinks it's a video game, and it's not a video game, and then he has this crushing feeling when he realizes what he's done. We've had parents object to that particular novel, and so in that case, the teacher would work with the parent to pick a different novel that does the hero's journey that they wanted to teach in Ender's Game, right? So there are ways to get around it, but for the most part, it's not something that happens very frequently here.
Is it the case that child rights and parent rights?
It's really variable. It depends on, it really varies from state to state. Our neighbors are much more child-focused. So if you look at Connecticut, Massachusetts, New York, even Maine, they're a little bit more on the child side. I came from New York. In New York, when we were doing an investigation, there were 19 safety factors that you, as a social worker, had to look for, right? And it was things like, does the child have a place to sleep? Do they, are there weapons in the home? And if so, are they stored safely? Because weapons in the home is not necessarily a problem. I mean, I grew up with weapons in my home. My dad hunted and, but the question is, are they stored in a way that the child cannot access them and accidentally shoot themselves or someone else? When I moved here to New Hampshire and started doing investigations here, there isn't anything like that. So it's really difficult. You have to really tie it into how did this condition harm the child? And that's not a bad thing, right? Because we shouldn't be intervening if kids aren't getting hurt, right? Because we can have differences in opinion on how it's best to raise kids. That's okay. Everyone has their own cultural traditions and their own values, and the state shouldn't be intervening on that. But I also had cases where, we had a kid with a broken jaw, but it was disciplinary, so it wasn't abuse. And I don't think that's appropriate. And I think that's why we end up with such a large number of children who are dying in New Hampshire.
I want to follow up on that. One of the things, I hope I have this right, correct me if I don't. One of the things I think you mentioned was that for the state to intervene in a potential case of abuse, the abuse has to be ongoing.
It depends on the situation. Like, it could be an incident that is severe enough for them to intervene that one time. Like, I would have thought a broken jaw would be. But frequently there has to be a pattern. But one of the issues with New Hampshire is they don't differentiate between unfounded being a false accusation and unfounded being the evidence doesn't rise to the level of intervention, right? So you may go out and a child has bruises, but you can't figure out why the child has bruises, right? The kid's not talking, the parents are saying, oh, he fell or whatever. But then you get another report in 3 weeks and another report in 3 weeks. But every one of those is unfounded because on their own, there's not enough information. New Hampshire makes it very difficult to pull those together and create a narrative in a way that it's not like that in other states. Now, again, I think the vast majority of parents are doing a fine job and aren't hurting their kids. But we know that some do, and I worry. And I worry when we have some of these bills. One of the bills was a constitutional amendment to say that parents have the ultimate authority to decide everything for their children, which would have made DCYF obsolete, because it would include discipline.
And that was the intent, wasn't it?
I believe it was, based on the sponsor.
To just destroy DCYF, or
No, I think the intent was,
eliminate it.
so I think, and this is a personal opinion, that there are individuals who genuinely believe that their children are an extension of themselves, almost like their belongings, and so they have ultimate control until the child becomes an adult. As a social worker, I think that the most healthy way is to help your child. Like, you want to give them the skills they need as an adult so they don't need you anymore, but they still want you, and that involves letting go of a lot of control and letting kids make sometimes really unfortunate choices, but those mistakes are part of adolescence. But we have people in the State House who believe the exact opposite, that think parents control what their kids read, see, do, and that extends to how they discipline. And again, physical discipline is allowed. But the way our statutes are written, sometimes it's easier for the police to make an arrest for assault than it is for DCYF to make a finding of abuse. And I've seen those cases. And it's frustrating for everyone involved. And to me, the biggest thing is it prevents parents from getting the help they need. Because in my experience, parents who are using physical abuse are doing it because they want their children to be well-behaved members of society, right? They're not doing it because they're evil people. They just don't have something else in their wheelhouse. Like, they need something else in the toolbox. So what they need is parenting support, not being arrested. I don't know how to do that.
Like this?
Oh, look, it went away. Good.
Yeah. Thank you very much to Paige Beauchemin, Heather Raymond, for your presentations, and to Jim Ravan for tremendous technical support, and George Russell for providing the instrumentation and the technical work to get us recorded. Thank you all. This will be on Nashua Public Television tomorrow? Tomorrow. So by the time you see this, we'll have been here yesterday. Just wanted to mention that again that we have another forum scheduled for Wednesday, October 23rd, which is a week from today, about New Hampshire finances, where the money comes from, where it goes, and why our property taxes are so high. That'll be right here in the theater at the library, starting at 7. And we hope to see you then. In the meantime, remember we have an election coming up. Pay attention, think about voting, please vote, get yourself educated, and we hope to see you next week. Thank you.